Lateral glide and translation of the atlas on a human. We checked.
Sort of.
We checked.
We're going to look at lateral glide of the translation of the atlas and also rotation of the atlas in a supine position. We've already established that we've made our introductions. We checked this table for security. We set it up for the posterior position, in which case I want tower all the way to the top of the table for doctor's positioning. I would adjust the footrest, and in this case I could also have the heels, both the hips and the knees flexed. It actually tends to reduce the tension in the extensors of the spine and actually helps to relax them. For translation or glide, our segmental contact point is going to be the lateral aspect of the TVP. To assess left translation, the ability of the atlas to glide or translate to the left along the positive x-axis, my segmental contact point is going to be the lateral aspect of the transverse process on the patient's right side. To contact this, I'm first going to palpate for the mastoid process, the inferior pole of the mastoid process. From here, I'm going to slip immediately inferior to this and then palpate medially. If you can't palpate the TVP, you don't palpate it well. If you feel you need to get a little bit deeper, what you can do is from this point here, slide immediately inferior, and then take tissue pull superiorly so you actually come up under the mastoid process. That's going to give you a little bit of slack to let you get a little bit deeper. Once you make that contact, the two-hand contact, the two ways of assessing this, you can either, one, just stabilize the occiput with the indifferent hand. In this case, I'm going to push from lateral to medial, from right to left, and feeling the amount of give and recoil that takes place under my contact point. Another method that most students tend to like because they can actually feel the movement taking place is simultaneously with my indifferent hand, I'm actually going to palpate the lateral aspect of the TVP on the left. And I do that by the same means we did so beforehand. In this case, I can trap the atlas in my fingers. To assess left lateral glide, once again, I push on the lateral aspect of the TVP on the right, feeling for both the giving quality and the recoil. But now also physically on the left, I can feel the atlas actually translate into or not translate into my finger. Many people like this because they can actually feel the movement taking place. So that would be, in this case, left lateral glide of the atlas in a supine position. For rotation, in this case in left rotation, our segmental contact point is going to be the posterior aspect of the TVP of atlas. To establish this, I did as I first did. I find the inferior pole of the mastoid process. I immediately slip inferior and palpate medially. That's going to find the lateral aspect of the TVP. From here, I'm going to slide posteriorly. Just like we had showed on the skeleton, right behind the base of the posterior aspect of the mastoid and right underneath the occiput, there's a little bit of notch in there. That's really where I want my contact to be. What you have to remember, though, is that as you rotate the head, your tendency is for this hand is to move out laterally. And if I don't take tissue pull to lock into this contact, as I do so, I'm going to come out laterally and actually be pressing in the back of the SCM muscle, not so much in the posterior aspect of the TVP. So to do this, once I find my contact, I'm going to slip my hand medially so that when I take tissue pull back out laterally, I can lock into that contact, and that's going to give me a good contact on the posterior aspect of the TVP. From here, with both hands, I'm going to rotate the head, in this case to the left, till I feel pretension come into my upside hand, in this case on the right-hand side. Just as we did with every rotation, if I want to assess joint play, I can back off this pretension and then come back into it, feeling the glide of atlas relative to the C2 below. To assess end play, I first establish pretension. Once I have pretension, my downside hand is stationary. It doesn't involve itself anymore, it just stabilizes the head. Through my upside hand, I'm going to continue to spring P to A relative to that segmental contact point at 1/8 of an inch, feeling the give and the recoil as I let go. The motion is created with the whole hand. Just realize that this is the segmental, this is your contact point, and the joint underneath is the one you're assessing, so the movement has to take place through the hand. What we'll watch out for in the test are people that do things as this. They rotate up here, then instead of using the whole hand, they take their finger and they literally push in like this. Too much effort. Not good use of your hands. Or two, a lot of people, I'll exemplify it, they get to this point here, and they'll start to rotate the head here, letting the hand that's actually of the contact not really spring through the joint, just kind of being a passenger. This is where the segmental contact point is. That's your lead of the movement, even though you're using the whole hand. Translation, and basically rotation of the atlas in a supine position.